In the richest nation on earth, it is simply not right that the skyrocketing profits of the drug and insurance industries are paid for by the skyrocketing premiums that come from the pockets of the American people. This is not who we are, and this is not who we have to be.
I've always wanted to work for my parents on their farm, but the year 2000 I had my wisdom teeth pulled and my jawbone would swell, and come to find out I had osteomyelitis. We didn't have the health insurance. They couldn't offer it because other small businesses like them couldn't afford it. So one of us had to go back to work for a large enough company that did, and it had to be me. Just financially, that's the way it worked out. It's like they've got you by the neck. I mean, because if you don't work for them and pay that price for that health insurance plan, forget it. You and your family could be on the streets. I mean, I love my job, but if someone were to ask me, is this really what you want to do? I'd say no, because if all else was equal, I would go back to farming.
I was diagnosed with cancer, with malignant melanoma in May of 2006. Right now, my insurance that I was under at the international school is still in effect. Starting next year, we'll have to figure out another way to get health insurance. And based on pre-existing conditions, it will be very difficult for me to get health insurance at that time. And what would I do? Not get the operations or not get the therapy that I need? It would be devastating for me personally and for us as our family, for our family.
I have quite a few medical problems, and so I take a lot of prescription drugs. And I thought, well, if I sign up for Medicare Part D and I pay the premiums and I buy generic drugs, that I won't have to worry about it. And I found out in July, after I had gone through $2,400 worth of prescription drugs, the donut hole was $3,500 deep and wide. My husband and myself, we just feel like we're always on the brink. I never realized that in this country you could be so powerless that you didn't have what you needed to stay alive.
Whatever it was, they have individual stories, but they all add up to the same thing. The current healthcare system pushed these families over the edge financially. Half the families in bankruptcy were there in the aftermath of a serious medical problem. But the scariest part was that about 3/4 of those families had health insurance at the onset. We all have a stake in getting a better healthcare system and getting costs under control. Because if we don't fix this problem, we don't know whose number comes up next.
Some of you know that my mother died of ovarian cancer in the prime of her life. She was 53 years old. And do you know what she was most worried about in those final months? She was between jobs when she was diagnosed, and she wasn't sure whether the insurance would cover her treatment. So I know what it's like to see a loved one suffer because of a broken healthcare system. I know that it is wrong. I know that it is not who we are, which is why when I am president, we will have universal health care in this country by the end of my first term in office. It's a plan that'll cover every American and cut the cost of a typical family's premiums by $2,500 a year. And I will not let the drug and insurance companies spend another $1 billion to block reform, because people like my mother shouldn't have to worry about bankruptcy every time they get sick. America is better than that, and we are going to make it happen in Washington.
The Obama healthcare plan is a sensible, affordable, cost-effective plan.
If you have coverage and you like your coverage, you can keep it. The only thing that changes is that your premiums will go down by up to $2,500 per typical American family per year.
If you don't have insurance, then you can choose from a range of options, including purchasing public insurance or purchasing other private health insurance at a reduced cost.
And that would be open to everybody. There would be no problems with pre-existing conditions.
And the important thing is, if you move from place to place, it's portable.
The last thing is that for people who are truly on the edge financially, there will be subsidies available that are prorated according to the amount of your income.
The benefits would be similar to the benefits that are available to members of Congress. They would be equally comprehensive.
It'll cover mental health services, it'll cover prescription medications, it'll cover physician's visits, so it will not be a skimpy option with very high cost sharing. It'll be a real serious plan.
And then when we start looking at what we're spending our dollars on, there are a number of things he addresses head on. First is the price of drugs. During the last administration, we gave up the capacity to negotiate with drug companies to get the right price.
So our plan would allow Medicare to negotiate drug prices with drug companies, just as the Veterans Affairs hospitals are able to negotiate lower drug prices with drug companies.
Another way that we can address the rising costs of health care would be to use the electronic medical record.
Every year in the healthcare system, 50 billion transactions take place. 90% of those are on phone, fax, or on paper. That's an inefficient system. We can convert to an electronic medical record, have health information in exchange, and what used to happen, paperwork that cost $25, will be a simple transaction that will cost pennies.
Another way we will lower costs is by providing federal reinsurance to employers.
Say that you're a small bookstore owner in Peterborough and you have 5 employees, and one of them contracts leukemia. That person's medical expenses will be $1 to $2 million over the next year. Under our plan, the federal government would act as sort of a Lloyd's of London and say, for catastrophic illnesses, for small employers, the federal government will take over these expenses.
The best way to reduce spending on healthcare is actually to reduce incidence of illness in the first place. The Obama plan will deliver incentives to businesses and schools, families, and individuals to maintain healthy lifestyles.
Any insurance company in this country spends about 80% of its dollars on about 20% of their people. We need to manage their disease through solid chronic disease management, reward the providers that are doing that, and make sure that the patient is getting the care they need at the time they need it, where they need it.
We think that through all of these measures, through helping out very sick people, through preventing illness, through dealing with the waste and the inefficiency, we'll save the typical American family about $2,500 a year in medical care.
Obviously, there are going to be startup dollars that are going to be required. And if we simply let the tax breaks that George Bush put in for people earning $250,000 a year or more expire, as they are planned to do, those dollars will be available to put them into this tremendously important program. Frankly, the last time George Bush went to the Congress of the United States, he asked for $190 billion for Iraq. It's about time that people started to ask for money for the people here who need care.
Some of the things that I really like about Barack's plan is that, first of all, when I was employed by the small business would have had help to make insurance more affordable, both to them as an employer and to me and my family. Secondly, when I left my employment and was faced with carrying these huge premiums to try and protect my family, I would have had an option to be able to access more affordable health insurance. And it would have ensured that we would not be turned away for insurance because my husband has arthritis. I also would not necessarily be making a choice about where I'm going to be employed by, do they offer health insurance? What kind of insurance? Is it going to cover what I need? And I think that that's very important.
No matter how great the plan is that you bring to the plate, it's not going to be implemented just as is. That plan that you bring to the plate has to be matched by the skills and the talents and the commitment of the individual who's president.
The person who's going to get it done is the person who can reach across everyone in society and say, you know what, I hear what you're saying. I want to work with you. I want healthcare to work for you.
It is such a big initiative that it really takes somebody that can bring Democrats and Republicans and independents together and make a consensus.
I am in this race because I want to stop talking about the outrage of 47 million Americans without health care and start actually doing something about it.
It was clear very early that he was very brilliant. And for a long time, I have seen in Barack Obama that capacity to inspire in a way that you just can tell is genuine.
He's coming into this having been the average person, having, worked the job and built his way up. And I think that's so important for our president.
Barack Obama is the only candidate in either field that has demonstrated an ability to work with people from both parties.
I actually served under him in Health and Human Services, and Barack had this leadership within him of just bringing it all together.
Special interest groups have been in the way blocking health reform. I think that Barack Obama will be able to get through that.
The dialogue will be open to the public, so every American will have the opportunity to listen to what's going on.
I spoke to him for a minute after the roundtable discussion was over, and he looked over and he says, "I'm worried about you." and and that touched me.
I expanded health care in Illinois by bringing Democrats and Republicans together, by taking on the insurance industry. And that is how I will make certain that every single American in this country has health care that they can count on. And I won't do it 20 years from now. I won't do it for 10 years from now. I will do it by the end of my first term as President of the United States of America.